Good morning. Thank you all for joining us today for the Healthy Minds, Healthy Kids rally to draw attention to the urgent need to support the behavioral health of children and families in New York. My name is Alice Buffkin, and I am the Associate Executive Director of Policy and Advocacy for Citizens Committee for Children, or CCC. CCC is a child advocacy organization dedicated to ensuring every New York child is healthy, housed, educated, and safe. We also help lead the Healthy Minds, Healthy Kids campaign, a statewide coalition of behavioral health providers, advocates, and family organizations seeking to ensure that all children and adolescents in New York receive the high-quality behavioral health services that they need. We're all here virtually because we believe that New York's children are facing unprecedented challenges to their mental and emotional well-being, and because for too long, families have struggled to access desperately needed services in an under-resourced system. Today, we will be hearing from several incredible speakers about the behavioral health challenges facing children and families in the state and the steps state leaders can take to address these urgent needs. Throughout the event, we encourage you to engage in the conversation in the chat. You can find instructions on how to participate in the feed below the video stream, as well as information on how you can tweet about the event and the messages that you hear today. As you hear from our speakers, we also ask you to take action by submitting a letter to your elected leaders, urging them to invest in children's behavioral health. You can find a link to this take action in the chat. With that, I'd like to turn it over to our first speaker. We're going to hear from Dr. Warren Ng, who is Professor of Psychiatry at Columbia University, Medical Director for Outpatient Health at New York Presbyterian Columbia University Irving Medical Center, and Director of Clinical Services in the Division of Child and Adolescent Psychiatry at CUIMC. He is also the president of the American Academy of Child and Adolescent Psychiatry. Dr. Ng, I'll turn it over to you to start us off with a discussion of the depth of the need nationally and in the state.
Thank you. Thank you so much, Alice. And thank you for CCC and Healthy Minds, Healthy Kids for hosting this important virtual rally. It's really a privilege to be here with you and with my national scope as well as my local scope, which is really my day job and passion as practicing child and adolescent psychiatrist in Washington Heights in New York City. I think it's really important to center our dialogue on really the scope of the problem. So nationally, after 2 years of a pandemic trauma, we are definitely seeing kids flooding our emergency departments and schools with mental health crises every day. That's why on October the 19th of last year, we couldn't bear witness to the tragedy anymore, and sounding the alarm was necessary. So 3 organizations serving children, youth, and families, the American Academy of Pediatrics, as well as the American Academy of Child and Adolescent Psychiatrists, as well as the Children's Hospital Association, really representing over 77,000 pediatric physicians in 220 children's hospitals across the country, declared a national state of emergency, really to raise awareness, but also to take action like you're here today in terms of responding to this crisis. Also, on December the 7th, the US Surgeon General, Dr. Vivek Murthy, announced the advisory of protecting youth mental health, because it's really about a roadmap for all of us to take action, not any one of us, because we definitely have to respond as a community, as families, and support. This is a moral obligation, not a medical one. And really, it's really to help our children and really to serve them and to step up and do that. The fact that 1 in 5 children and adolescents have a mental health condition at any time, and less than half of them get any care or quality care, is a crisis. COVID-19 has definitely exacerbated this pre-pandemic silent crisis. And really just in the last year, we've seen 24% increase in emergency department visits for children aged 5 to 11. Think of that. 5 to 11, and also an increase of 32% for those adolescents aged 11 to 17. This is on top of the fact that suicide is already the second leading cause of death for youth aged 10 to 24. And during the pandemic, the CDC has reported that there's been an increase in both adolescent girls and boys, but an increase about 50% for adolescent girls in terms of suicidal behaviors. In Washington Heights, where I work, we're treating a diverse and predominantly Latino and Black underserved community. What I'm seeing every day are kids in the emergency room who have lost hope. It's heartbreaking, and their families are suffering. COVID-19 has had a disproportionate, tragic impact on kids of color, particularly Black and brown kids. And within the first 15 months of the pandemic, over 140,000 children and adolescents across the country lost a parent and a caregiver. And 65% of those, over 90,000, were racial and ethnic minoritized youth. And even within New York State, we know that 1 in 600 children who are Black and 1 in 700 Latino kids lost a parent or caregiver in the first 5 months of the pandemic. Many of these kids are living in single family homes. We know that a quarter of kids do that, and many of the families are struggling to deal with many of the stressors in terms of keeping children and families together. Sadly, this is happening every day within our communities, and I've never seen a crisis like this before. And the mental health services and the needs of our kids and their families are collapsing our healthcare system that is already burning out. So your participation, your action is critical. We definitely have to respond to this crisis as a community. And while statistics and numbers are important, they don't capture the human experience. So I'm just really grateful for the voice of our youth and families. And I'm excited to hear from Eugenia in terms of really shedding light on this important issue.
Thank you, Dr. Ng. I think that's such a powerful way to lay the landscape of the depth of the need in the state, the urgent need for us to act as advocates, as legislators, as parents and caregivers, and really appreciate your opening words. And with that, I'd like to turn it over to a really incredible legislative champion, Assemblymember Chantal Jackson, who has joined us today and is going to share a few words about the need for children's behavioral health services and the work that she's doing. So with that, I will turn it over to Assemblymember.
Thank you so much, Allison. Good morning to everyone. Thank you for joining this call. This is an extremely important topic that we are discussing today. It's pretty much my life's work as a social worker in the New York City Department of Education school system. You know, I just left the classroom as of not last year, but the year before. And so I've been working with students and children the majority of my career. And most people know I bring my son with me every day to work because it's so important. First of all, he helps me with my mental wellness. He makes me feel good about life. Like, this is why I show up every day, why I continue to do what I do. But mental health is something that we've all struggled with at some point in our lives. And as children deal with it, it's not an easy feat because they don't necessarily know the feelings. They don't know how to identify them. And if they're in a toxic environment where people are not helping them to explore those feelings, then it can become worse. And we can start seeing them utilizing different ways to cope that are not helpful to them. And so, you know, the services that we offer are absolutely necessary. We do not spend enough money. We don't spend enough time in these services. And so with me being a social worker here in the state legislature, with other people who are nurses and people who actually dealt with children, work with children, care about children well-being, have children, we have a voice that may not have been heard a few years ago, maybe even. And so it's my job, I feel my duty to keep uplifting these issues so that the whole body is aware that we need support, we need resources, our kids need it. They we say they're our future, but the truth is they're our right now. And the harm that they experience today, they will be living out for the future. And so I want to thank everyone on this call who is doing the work. And this is not easy work. Trust me, I know. So thank you for the work that you do every single day. And I know it gets hard, but just know that you have changed lives. You will continue to change lives. And whatever you need from me in support, you guys know how to reach out to me. So thank you for allowing me in your space. And thank you for continuing the work.
Thank you so much, Assemblymember Jackson. I think the phrase that children are future, but they're our right now is so relevant. We have to invest now. We have to support children and families now so that we can see that future for all of them. So thank you for your advocacy. Thank you for your words and for sharing your experience. And with that, I want to turn it over to another incredible champion for children, for families, for behavioral health supports, and that's Assemblymember Aileen Gunther. So Assemblymember, I will hand it over to you.
Hi, everybody. Can you hear me?
Ms. Stanton moves to amend the bill by.
Yes, we can.
Hello. You can hear me?
Yes, we can hear you.
Okay. Good morning, everybody. I'm at home. I'm in isolation at this point until tomorrow. So thank you for having this. And, you know, I have been the chair of mental hygiene for a while. I know that my colleague that just spoke talks about some of the needs in all of our communities across New York State, especially with the Black and Brown community. Some good news is the $111 million that we recouped premium that was underspent in the mental health field. And so we're recouping that. And also the Child Health Plus insurance coverages for immigrant communities that were before excluded from Medicaid. You know, I've talked to Ann Sullivan at length. I think that Kathy Hochul is aware of the needs in our community. You know, the suicide rates are unimaginable. Absolutely unimaginable. Our children are in such distress. My son is a teacher in a New York City school, and I'm telling you, these children need more help than ever, and we do have to invest in it. You know, all I can say is that for me, I've been a loud voice about this. It distresses me that, you know, we give money to corporations and all other things, and this is to the children that deserve this money. We are taxpayers, and we should have some decision-making opportunities on where our money goes. And some of the money, more than some of the money, should be going to the mental health field, and especially to treat our kids. We need social workers back in the school. We need counselors back in the school. We need nurses back in our schools. We cannot have one for 3 different school districts. It's just terrible. And I'm going to keep fighting. I'm annoyed and I'm mad. And you know, I'm scared for our children. And these children are going to grow up to be adults with all kinds of different issues. So it's really tragic. And I'm going to keep fighting. We're in the budget talks today, and we're voting, and I'm going to be a loud voice for all of this in the budget talks. So I thank you for what you do. I can't stay on long because I have to go back to the budget. I'm still fighting the good fight for mental health. And, you know, at this point, it's so important that your voices are heard, and I'd have families and anybody you can call every assembly person, call the governor's office, call Andrea Stewart Cousins, call Carl Hasty, and say, increase the funding for mental health, and especially for our children across New York State. We're in dire straits. We need this more than ever.
Looking very large.
I get emotional when I talk about it. I really do.
And we appreciate that. I thank you so much for your words, Assemblymember Gunther. You know, you've been such a vocal and passionate voice, but also, as you said, a fighter for these issues. And we really appreciate your championing of mental health supports for young people and their families, and also appreciate that call to action. You know, this is the work of all of us to put that pressure on and say why this is so important. And we have such great champions on this conversation today, but also listening in. So thank you so much for sharing that perspective.
I know we're talking about children today, and I really quickly have to say that there was a gentleman that set one house on fire, and they let him out because of bail reform. And I'm not going to discuss bail reform, but they let him out. The judge had obviously no action he could take. Second time within a week, he did it again. The third time in a week, he did it again, and somebody died on the scene. And for me, if they had some mental health is some way to create some kind of system where there would be somebody to get this person to where they belonged in the treatment that they needed, but they didn't. And again, somebody died because of it. So it's a lack of treatment that's creating crimes across New York City, because these people need help, not the cell. And I agree with you completely. There's so much to be done. It's just overwhelming.
And I think important piece is the earlier we can get supports to young people, the earlier we can get supports to children, the better we see the long-term impacts. And adults, absolutely.
It's across the board. And this is an example of what happens. Mm-hmm. Without some place to help these folks. And they've closed the beds across the pediatric beds, the adolescent beds, the adult beds. And you know what? psychiatrists and even if you have health insurance, they don't accept the health insurance. They don't accept the reimbursement. So where do we go? So we're depending on social workers. We're depending on our schools, and we just have to do more. And we need more beds for children to do appropriate evaluations. And if they're put on medications, to start them on medication and observe the reaction to the medication to see if they're working or not. And that's, thank you very much for giving me this time to speak to all of you.
Of course, thank you so much. And yeah, we need to treat behavioral health for all ages as the priority it should be. So thank you for continuing to fight for that.
Thank you. Bye-bye.
Thank you. And with that, we really appreciate the words of Assemblymember Jackson, Assemblymember Gunther. And with that, we are now going to turn it over to Eugenia Banfo. Eugenia is a high school junior from the Bronx and a mental health advocate. She's going to speak to her own experiences and those of her peers. So Eugenia, I will turn it over to you.
Hello, everyone. Thank you so much to CCC for having me. My name is Eugenia Banfo, and I'm a Youth Action member at CCC. Youth Action is an after-school advocacy program facilitated by CCC, which teaches NYC youth to be better advocates through helping them develop their own youth-led advocacy campaigns. I'm a high school junior from the Bronx, and I'm the child of Ghanaian immigrants, and I'm deeply passionate about advocacy and social justice. I'm so grateful to be here and to be speaking to you all today. 2020 and 2021 have truly been years of unprecedented and widespread change. Our world did a complete 360 as we all worked to battle the COVID-19 pandemic and the struggles that resulted from it. From the many months spent in isolation, adjusting to new virtual spaces, and dealing with the effects of the virus on our family and ourselves, we've truly endured many challenges in the past 2 years. Last year, Youth Action members surveyed more than 1,300 youth from across New York City in the Voicing Our Future survey. Young people were surveyed on various topics, including mental health. The survey found that over 1/3 of the youth surveyed reported wanting or needing mental health services from a professional, with youth from the Bronx and Manhattan reporting the highest rates. In addition to this, we found that of those who reported needing mental health services, only 42% received them. When asked what important resource they wish they had as a young person in NYC, mental health was the second most needed resource. Before the pandemic, we were used to our daily routine of going to school every day, hanging out with our friends, and enjoying our youth. Government lockdowns and school shutdowns restricted us to our homes, isolating us and cutting us off from the outside world. In solitude, many of us yearned for social interaction and connection. In the absence of it, we tried our best to still connect with others. However, text messages, FaceTime calls, and Zoom meetings could not make up for the cherished closeness, connection, and contact that we received from being together. The prolonged solitude had a drastic impact on the mental health of many teens in NYC. We missed our friends, we missed our teachers, we missed school events, we missed hanging out. We missed what made high school for us. Gradually, struggles of adapting to a new educational environment, losing our daily routine, and the effects of solitude began to take a toll on us. Many saw their grades slip as they struggled to adapt to virtual learning. Others struggled with issues outside of school and at home, such as unemployment, family members catching the virus, or even losing family members to the virus. All these issues came together to result in the debilitating mental health of our youth. In addition to suffering from mental health issues, many teens felt hopeless, as they also struggled to find ways to cope with these issues. Many of us struggle to approach our parents with our mental health issues, as we're scared that our parents will look down on us, not take our issues seriously, or even use our struggles against us. Some of us also lack trusting relationships with our parents and don't feel comfortable approaching them with our personal issues. This makes it difficult for many students to seek professional help without their parents knowing. When teens are unable to turn to their parents or a family member for help, many would suggest that the teen turn to their guidance counselors or a trusted adult in their community. However, many guidance counselors are not available, overworked, or aren't qualified to provide mental health assistance. Many of my friends have said that their guidance counselors are often too busy helping with schedules, transcripts, and college applications to assist them with their mental health issues. It can also be extremely hard for students to open up to a guidance counselor when that information is not confidential and is shared with parents. To make matters worse, guidance counselors will often ask about a student's grades and school performance instead of paying attention to the actual root of a student's issues. Well, it looks like you've been failing in a few classes. Of course, you'll have mental health issues, many will say. Instead of referring students to therapists and free mental health services, they suggest the students try harder in school, leaving the student unsatisfied and their mental health issues unresolved. This further goes to show just how unqualified some of these guidance counselors are. Many have been trained to help students with achieving academic success, while many are left untrained and unqualified to handle the personal challenges and issues students face. Stories like this have circulated among teens and online, creating widespread distrust of school guidance counselors. Now, outside of home and school, where else can students turn for help? The answer is often nowhere for many. There are many racial, cultural, and economic barriers that exist with mental health and reaching out for mental health services, and we must acknowledge them. Being a low-income Black first-generation immigrant, I've seen this firsthand. In many Black communities, mental health is largely overlooked and is rarely prioritized. On multiple occasions, parents have shamed their children when their children have come to them about their mental health issues. Many completely dismiss the idea of their child being a victim of depression or any other mental health matter. And even when the children ask for mental health assistance, they're met with disapproval and resistance. Many people in my community don't believe in therapists and don't like the idea of their child taking their personal problems to a complete stranger. They fear that the community will also discover that the child has mental health problems and subsequently shame them or the child. While speaking on this issue, I don't want us to blame all the blame on the parents. This is a result of years and years of mental health neglect in our cultures. Seeking mental health support has rarely been a practice in our communities, and many children and adults have instead been told to suck it up or deal with it when they were clearly struggling. The many years of neglect has translated into a continuous generational cycle of unhealthy practices and prolonged mental health issues. Aside from this, the potential costs of mental health services often deter teens from looking for help. Traditional mental health support services and resources are not cheap, and many teens know this. Low-income teens in particular are completely discouraged from seeking out mental health services outside of school because of this. For many young people and families, it can be impossible to find mental health support. Even when there are free mental health services available to teens, there's a severe lack of awareness and access to these resources. Because of this, many of us automatically assume that they don't exist and choose to suffer in silence. This leaves many teens who could have been helped left without support, unnecessarily prolonging their mental health issues. As a teen who has experienced mental health issues myself and who has experiences similar to those I've spoken about earlier, I'm here to advocate for myself and them. Seeing how the lack of accessibility to mental health resources affected me and my friends when we were struggling, there must be an increase in mental health support resources in and outside of school. In addition, there must be an increase in accessibility and awareness of these resources. Many students, particularly those who are low income, continue to struggle with mental health because they think that the only mental health resources that exist are the ones that you have to pay for. If we are able to increase funding for mental health and increase awareness and accessibility, we'll put an end to this cycle of the mental health needs of low income people going unresolved. These past few years, we've seen a drastic increase in student suicides. I've also seen a dramatic increase in suicide idealization on social media. It has gotten so bad that it has been normalized, and these social media posts have been played off as jokes. More must be done to support our youth. Many are struggling, and many continue to struggle when new policies can easily prevent it. Thank you so much.
Thank you so much, Eugenia. Your perspective is so important, and we're so grateful. You know, I'm seeing all the other speakers just applaud because thank you so much for sharing that. That was so powerful, so comprehensive. And, you know, I think we're grateful not only for you sharing your words, but also for your advocacy. So thank you for continuing to do this work, and we look forward to hearing from you for a long time. I'm now, with that, going to hand it over to Keith Little, who's president and CEO of SCO Family of Services, who's going to speak to the ways that underfunding of the behavioral health system has prevented families from accessing care. So Keith, I'll hand it over to you.
Thank you, Alice, and good morning. Can you guys hear me?
Yes, we can hear you.
I've been doing this work for over 35 years, and each year we do advocacy. This year I'm feeling very much different. I really believe that the system is at the tipping point. And I wouldn't say that at points in the past. And I'm really asking for an investment, a long-term investment in services to children and families. Let me tell you a little bit about SEO. SEO is very much has a large footprint in downstate region, both in Long Island and New York City, in mental health services. We operate residential services, we operate crisis services, we operate mental health clinic programs, and we operate programs that are community-based programs such as children and families treatment support services. In each one of those programs over the last 15 months, our organization has experienced a decline in our ability to provide services. I think I mentioned, Dr. Ang had mentioned about data. Data is showing us that if collectively, we're probably down about 28 to 30% in terms of our ability to provide services. And it's not because we don't want to, it's because we don't have the ability to provide the services. And I think it's twofold in terms of two of the driving forces. One of the challenges, which is a core issue that you will hear like a broken record, is the fact that we haven't invested in our workforce. And when I say we, I'm not talking about SEO, I'm talking about the system has not invested in the workforce. So our ability to retain and to recruit new talent and to be able to provide services has been extremely hampered. I cannot find people, I cannot pay people appropriately. The second issue is related to the rate. The rate that we're given by government is, we appreciate it, but it's not enough. And there has to be a rate adjustment to increase our ability to recruit and retain and to provide those services that are desperately needed. I know for me, 90%, I think it's 92% of the individuals that I service are people of color in communities of color. And we know also over the last 2 years since the pandemic started, it's exacerbated our ability to provide services. I know if I look back 3 years ago, I knew that I could provide services. Since the pandemic, there are additional needs of the constituents that we serve that have been identified, and we can't possibly meet those needs. So I appreciate that Governor Hochul is proposing a 5.4% COLA. I ask that that be supported, and I ask that it be increased in some instances because I think it's needed. I think we're desperately trying to make ends meet. We're desperately trying to address social justice and equity issues, and we need help from the state legislature to do the work that we need to do. I think for me, I know the population that I can't possibly service now because I don't have the dollars and I don't have the staff. What I'm worried about also is that I don't know about those who haven't come to the forefront. There are people out there that need our services we don't even know about. And so we can't even think about servicing them because we don't have the resources. So I ask for us to have collective support and to realize that this is a call to arms for all of us. This, I believe, like I was mentioning before, I believe we're at the tipping point. And I believe we're at that point where if we don't do something dramatic and quickly, we're going to be at the point of no return. And there are going to be a lot of entities and a lot of organizations that fall by the wayside, which makes government's job that much more difficult. So I thank you for the time. I hope that you will support not just this year's effort, but a long-term plan to keep the system viable. Thank you.
Thank you so much, Keith. I think your words are so helpful for understanding some of the systemic barriers that are preventing us from reaching children and families who need care, even when the desire is there to reach these families. Where are the resources and where have we been as a state for many years to get us to this place? And additionally, thank you for calling on us to take action. I think that's so important for all of us as we're listening. And to sort of continue that conversation, we're next going to hear from Maria Cristalli, who's president and CEO of Hillside Family of Agencies. She's going to discuss some of the access issues and opportunities to address them in the budget. So Maria, I will hand it over to you.
Thank you very much, Alice. Thank you. And thank you to Keith, to Consider, and the other panelists to continue the conversation. Hillside is an upstate agency. We're a child and family services organization in Central and Western New York, and we serve approximately 10,000 children and families each year. We're grateful to Governor Hochul for her commitment to the children and families of New York. I'd like to share some feedback today on her proposals related to workforce and mental health. To Keith's point, we know this system needs investment. I've been working in the system for over 30 years now, and there has never been a time like this one. Even before the pandemic, the capacity of the children's mental health system was insufficient to meet the need. As we heard this morning from Eugenia and Dr. Ng, information on the need going up. We're seeing an increase in depression, anxiety. The children have to gravitate back and forth, isolated, back in school, remote learning. This has been almost a 2-year phenomenon, folks. And as Keith is mentioning, as a provider organization, we've had to at Hillside pause intakes. I know many of our peers are in a similar situation, not because we want to, because we have significant workforce shortages. We at Hillside now have approximately 270 open positions. And here's how that shortage is affecting families. Families are worried about their ability to keep children at home because no one can help, and they need help now, and they're losing hope. As a provider organization, we can only do this with a significant multi-year investment in our workforce. As Assemblywoman Jackson mentioned, children are our now and our future, and they're depending on us to advocate for these investments. We support the following proposals. The 5% cost of living adjustment, as Keith mentioned. We support that, would like to see some additional additions like care management added to that COLA. We support extending APG rates for clinics, crisis stabilization centers, and ambulatory behavioral health services for children covered by Child Health Plus. We support enhancing RTF rates and revising the state methodology. We also support a reinvestment of Medicaid managed care recoupments from underspending on behavioral health services. We have other ideas because this will take multiple investments for helping providers recruit and retain a workforce. Some ideas include enacting a state income tax credit for children's mental health workers and workforce support programs so we can help workers get in the door with examples like non-taxable grant payments for childcare, transportation, and housing. We're grateful that Governor Hochul added additional mental health services to the Child Health Plus benefit, investing $11 million in fiscal year 23 and growing to $44 million in fiscal 24. Because of the mental health crisis, there are an increased number of children that are boarding in hospital emergency departments due to behavior challenges. Dr. Ng mentioned a 24% increase in ER visits for behavioral health. A recently published article in the New England Journal of Medicine, Catalyst, highlights the cost of $219 per hour for these children with very little benefit to the child or their family. While we appreciate the governor's investment in home-based crisis intervention, we can go even further by creating a short-term diversion service that combines out-of-home services with intensive in-home services for children and families. Finally, a family shared with me that they had recently had their child discharged from residential treatment after many months and went back home with no services because of the workforce shortage. The child ended up in the hospital for an entire month. We know this scenario happens too often, and we can do better. Thank you, Alice, for the opportunity to give feedback today.
Thank you so much, Maria, for sort of continuing the conversation and pointing out that, you know, this is a budget that has really important investments that we want to see supported, we want to see enhanced, and we're very appreciative of those pieces in the budget, but we also know the depth of the need is so great. So there are many areas that we need to continue to see how can we support children and families, how can we get them the services that we know work. We have innovative policies, we have innovative interventions. We just need to have the commitment from our state to say every child, every family should have access to these services. What are the steps we need to take to get them there? And so I think we are now going to head on to our final speaker, Kim Kaiser, who's Director of Diversity, Equity, and Inclusion at Families Together in New York State. She's going to highlight the urgency of the need in the state and make a call to action. So Kim, I will hand it over to you.
Thanks so much, Alice. And thank you, everybody. Powerful speakers. I'm so grateful that we have this platform to elevate this need. And I also, just like Maria, want to acknowledge our appreciation for the governor's recognition of the needs within children's behavioral health. But as Martin Luther King said on this day 2 of Black History Month, that budgets are moral documents. They are moral documents. So we have so much more to do, as we've already heard from our speakers who work, lead, advocate for the most vulnerable of New Yorkers, our children and youth. We know that COVID did compound the issue, but there was an ongoing chronic need for improved access, workforce issues, and equity on the landscape of children's behavioral health. Right now, we're in the throes of a children's behavioral health service famine. The impact was before COVID and still is clear, especially in those communities with a history of being historically and systemically marginalized, where your zip code determines your future, where ongoing housing deficits, employment, crime rates, educational services, and hope is at a deficit. No child should be facing both these things at the foundation of their day-to-day existence and not get the help that they need when they are facing a behavioral health crisis. The impact of the intergenerational and historical trauma is very deep-seated across the state. The help and the acknowledgement that we are currently poised to benefit from the governor just don't match the need. We're looking at a public health crisis. There is a huge bottleneck in this system that was fractured before any of us knew COVID was on the horizon. And I said this last year, and I'm going to say it again and again and again. We cannot place a Band-Aid on the battlefield of disparity in this area. Mental health is health. If you break your arm, if you're having suicidal ideations, we need to tackle this the same way. And the bottom line is that there is so much missing from what we have now and what we have been offered, that we're going to see a type of crisis similar to that we saw during COVID, where hospitals and doctors were not able to meet the need of individuals flooding into their emergency rooms dealing with COVID. We shouldn't be doing this with any situation that impacts the health and the need for anyone in our community, let alone our children. In Brooklyn, there's a young girl that I'm working with who is dealing with some mental health issues. She's also autistic. She's waited 8 months for services within the mental health system. She dealt with depression prior to COVID. When COVID hit, she lost family members. She had friends who lost their parents. She already was living at a baseline of fear, living in poverty, her safety, all of this laid in the background of her daily life. She now engages in self-injurious behavior, school refusal, and grief. What does this family get? They get a CPS call. Have they gotten mental health services? No. I also work with a young man who is dealing with grief and loss prior to COVID. He has a post-traumatic stress disorder, depression and anxiety. He has had 3 providers since 2019. In 2020, he had no providers. In 2021, he had one for 4 months. The urgency is clear, and the need is screaming from every single rooftop, every single emergency room, every clinician's office, every multi-service agency, crisis stabilization unit, from every child in the throes of a behavioral health crisis. Help us. So we're asking that you help impact both the present and therefore the future of New York by valuing our children and youth, valuing those who have always faced challenges and those who are facing new struggles in their emotional wellness. How could we expose our most vulnerable to a bleak future? When we don't meet these needs in behavioral health, we put our children and youth at risk of victimization in the community. We put them at risk of violence, of human trafficking, prison. So the time is now to make a change for the future. The time is now to value mental health for our children by investing in our future. Thanks.
Thank you so much for sharing, Kim. I think we could not have ended on a more powerful or compelling description of the needs facing children and families and a call to action. I just want to thank you for the work that you do with families, for your words and for your advocacy. And I hope that those who are listening take these words of Kim, of all of our speakers, and use them to fuel you and to say, these are deep, entrenched problems, but there are solutions, there are answers. With our collective work and our collective advocacy, we can change this narrative. So on that note, I want to say that before we conclude, we ask again that you submit a letter to your elected leaders urging them to act. You can find a link to the e-action in the chat. We urge you to stay connected with the work that's happening here, to share your stories, to connect with us if there are issues that you want to raise. And again, I just want to sincerely thank all of our speakers for their time, for their powerful words, their advocacy. We will all continue to advocate for the behavioral supports that children and families need. We hope you'll join in these efforts in the coming weeks. So thank you all and take care.